So the posterior compartment contains the hamstrings, semimembranosus, semitendinosus, and biceps femoris. The anterior compartment contains the powerful anti-gravity extensors of the knee, called the quadriceps. So these muscles are used when standing and when swinging the limb forward in walking. This region is supplied by the femoral artery, and the other two by branches of the profunda femoris artery. Also the femoral nerve, the sciatic nerve for the posterior compartment. Finally, the medial or adductor compartment is supplied by the obturator nerve. The blood supply to the thigh comes almost entirely from the femoral artery, which emerges underneath the inguinal ligament, a ligament between the pubic tubercle and the acis, and is the continuation of the external iliac artery, which has ended at this point. There's a gap in the adductor hiatus muscle here, adductor magnus muscle, called the adductor hiatus, and this provides passage for the femoral artery to go out of the muscle into the popliteal fossa, at which point it becomes the popliteal artery. The femoral artery has a main branch called the profunda femoris, which runs down next to it, and the first branches of this are the lateral and medial circumflex arteries, which move to anastomose around the hip joint. And then 4 branches, usually 3 or 4, coming off to supply the medial and posterior compartments of the thigh. And these are the perforating arteries, because they perforate the intermuscular septa. So where the femoral supplies the anterior compartment, the perforating arteries supply the posterior and medial. The iliopsoas inserts or attaches to the lesser trochanter of the femur. It's formed by the iliacus, which fills the upper 2/3 of the iliac fossa, originating from it. The iliacus is supplied by the femoral nerve, and arteries include the medial circumflex and the iliac branch of the iliolumbar artery. The other muscle of the iliopsoas tendon is the psoas major, which begins by attaching into the lumbar vertebra. Now, importantly and differently to the iliacus, the psoas major is supplied by branches from the lumbar plexus, unsurprisingly as it sits right next to it. The psoas makes up the large part of the posterior abdominal wall, along with the quadratus lumborum, and is surrounded by the psoas sheath of fascia, derived from the fascia of the posterior abdominal wall. Its action is to flex and laterally rotate the thigh. The same goes for the iliacus muscle. So flexion and lateral rotation of the thigh. The femoral nerve from L2 to L3 or L2 to L4, goes to supply the muscles of the anterior compartment of the thigh. So the femoral nerve, being different to the sciatic nerve, which comes through the greater sciatic foramen, the femoral nerve crosses with the femoral artery underneath the inguinal ligament. It also has overlying branches to the skin, supplying the cutaneous innervation of these muscles. The only other nerve of the anterior compartment to consider is the lateral femoral cutaneous nerve. This comes from L2 to L3 and follows roughly the same course just above the femoral nerve to the lateral side of the anterior compartment, where it supplies and innervates the skin. Since the femoral nerve travels down to the knee, sometimes pain can be referred from the hip onto the knee. The main extensor of the knee, quadriceps femoris, and also the main muscle of the anterior compartment, has 4 different parts. The rectus femoris attaches into the acis and the area around the acetabulum, and inserts into the patellar tendon. The rest was formed of the vastus muscles, the vastus intermedialis, vastus intermedius, joins the upper part of the femur to and connects into the quadriceps tendon, ultimately ending at the patella, and the tibial tuberosity just below it, vastus medialis, and vastus lateralis, and they both attach from medial and lateral sides of the linea aspera. The linea aspera is a ridge of roughened surface down the posterior aspect of the femur, so down the edge, down the middle. The vastus medialis is much more bulky than the vastus lateralis, and is more prone to wasting during bed rest, following which the counterbalance can actually dislocate the patella because the vastus lateralis has that much more relative power to it following this wasting of this one. The sartorius muscle runs over the top of the anterior compartment from the aces to the upper surface of the tibia. It can flex, abduct, and laterally rotate the hip and flex the knee joint, which can aid in sitting in a cross-legged position. The medial compartment of the thigh contains the adductor muscles. These muscles are used when walking once the limb is planted on the ground. They are the gracilis muscle, from the ischiopubic ramus to the tibia, and the only adductor to cross the knee joint. Sartorius, which I covered on the last slide, is also an adductor. Well, sorry, it's not strictly an adductor, but it has the same tendon as gracilis. Adductor longus and brevis, which go from the pubis to the linea aspera of the femur, and adductor magnus, from the ischial tuberosity and pubis to, again, the linea aspera, with the adductor hiatus for the femoral artery here. The medial hamstring part of this muscle is supplied by the tibial nerve, and the lateral part by the obturator nerve, which also supplies all the other adductors. Remember, the obturator nerve comes out of the obturator hiatus in the obturator membrane, which covers the obturator foramen here. It comes from L2 to L4 and then divides here either side of the adductor brevis muscle. And because it goes down to the knee, it can take referred pain from the knee to the hip.